one of the keys to successfully resigning from PPO plans is to communicate effectively with your patients.
Right.
And I'm a big believer in using every tool in our tool belt to communicate with them. And there, I've made it my life's work to be a student of communication. And we know through studying linguistics and communication that the words we use only make up 7% of the communication message. That's it. Linguists will tell us that. And some of you are sitting there, wait a minute, isn't it all about the words? Well, certainly the words are important, 7%. But there's everything else. There's facial expressions, there's tone of voice, there's volume, there's inflection, there's body language. And you just don't get that if all you're using is the words. Let me give an example, Naren, that every one of our listeners, every single listener, I can say without a shadow of a doubt, have experienced this. And I'm asking you as a listener to think about this for a minute. Have you ever sent a text message to someone thinking you communicated perfectly clearly, and then the person responds back with a very different tone because they somehow misread your text? And you have to jump back. Oh, no, that's not what I meant. And if it's a friend, you might pick up the phone and call, to intervene. Well, that text message was only using the 7% quotient, because the only thing you get in a text message are what, Naren?
It's just the words, right?
Just the words.
Yeah.
Just the
and
words.
Humans are very complex. I mean, words are like you said, 7% of how we communicate. It's all the other stuff. And even just you and me, I'm sure I've sent text, Gary, that I'm like, oh crap, I shouldn't have sent this.
Yeah, I didn't mean that.
Yeah. Well, because it just comes across not the way you want it. It just
not the way you want.
Yeah.
So I would believe that the most effective communication medium is face-to-face.
Yes.
When we're face-to-face with the patient, because now it's a two-way medium. You're delivering information, the patient's responding back and asking questions and respond. It's a two-way street. And so the most effective way is to communicate with your patients face-to-face. That's why, in my coaching work, one of the things we do is we get very strategic about our timeline as we're resigning from PPO plans, with the goal of talking to as many of our existing patients as possible as to what's happening in the practice. Mm-hmm. And we do that with a heads up conversation to let them know what's coming. And we do that face-to-face so that we get the full value of that communication. And so I want to emphasize that you've heard me talk about the heads up communication, where we let people know, what's happening. And we do it face-to-face.